This is Amber and Jay from Precision Assess. Welcome to the deep dive. Today, we're getting into something really fundamental for adult family homes. We're talking about nursing assessments. We've looked at, well, quite a few sources or state guidelines, nursing info, different guides, really trying to understand why these assessments are just so important.
That's right. And our mission really is pretty simple. We want to pull out the key takeaways, the core knowledge from all this material so you can see why these assessments matter so much. For everyone, really. The residents, the providers running the homes, the caregivers, everyone involved.
And here's the thing that jumps out, getting these assessments right, right from the very beginning. That's the absolute key. It's what makes sure people get the care they actually need, stay safe, and, feel comfortable and well supported in their home. Okay, so let's break this down. What exactly is a client assessment when we talk about adult family homes?
Okay, so at its heart, it's basically a careful professional evaluation. It's done by a registered nurse, an RN.
Right. So not just a quick hello and checking a few boxes.
Oh, definitely not. The sources all point to it being quite structured. It's about really figuring out all of a client's health needs, the whole picture. That means looking at their medical background, any health problems they have now, how they're doing mentally thinking, memory,
Uh-huh.
how they get around, mobility, and also what help they might need with just daily life tasks.
Daily tasks. You mean things like getting dressed or eating meals?
Exactly that. Dressing, bathing, eating, using the toilet. And it also covers things like special dietary needs, the condition of their skin, even behavior sometimes.
And collecting all this information, it has a bigger purpose than just knowing it, right?
Absolutely. It's the foundation. All these details, they create the blueprint for what we call a care plan.
A care plan, like a roadmap for their
Yeah.
care.
Precisely. Think of it like the instruction manual or the map that guides the caregivers every single day. It's what ensures the home can actually provide the specific support that person needs. One thing the sources really highlighted is that a good assessment stops problems before they start, like making sure the home is actually a good fit for the person's needs, prevents mismatches.
That makes a lot of sense. Okay, so who does this assessment? Does it matter who performs it? Are there, like, different rules?
Yes, there are. It often comes down to how the care is being paid for. So if a client's care is funded through a state program, here it's often DSHS, the Department of Social and Health Services.
Okay.
Then a specific RN who works with or for the state, a DSHS RN, typically does that assessment.
Got it. State funding means a state-connected RN. What about people who pay for their own care? Private pay clients.
Right, for private pay clients, it's a bit different. Any licensed RN in the state who has the right qualifications and experience in this type of assessment can do it.
And, well, that's where services like ours, Precision Assess, come into play. We provide those experienced RNs for high-quality private assessments.
Exactly. That's the niche we fill.
So, building on that,
Yeah.
let's get a little more specific about what the RN is looking at. You mentioned a few areas, but did the sources point out anything that's, particularly critical or maybe easily missed?
Yeah, the sources definitely stress looking at the whole person. It's holistic. So beyond the obvious things like checking their medical history and what medications they're taking,
Vital, I imagine, to avoid problems.
absolutely critical.
Yeah.
Avoiding dangerous drug interactions is a huge part of it. But then the assessment digs into areas that are often connected in ways you might not immediately think.
Can you give an example? Like
Yeah.
something that seems small but tells a bigger story.
Okay, well, think about skin condition or maybe changes in behavior. The sources show these aren't just like isolated things.
Mhm.
A change in skin could signal issues with nutrition, or maybe they aren't moving around enough. A change in behavior, that can mean they're in pain, or maybe there's a new health issue popping up, or even a side effect from a medication.
I see.
So a good assessment by a skilled RN connects those dots. It's not just a checklist.
Right. It's about understanding the why behind what you're seeing.
Exactly. And it definitely covers cognitive function,
Mm-hmm.
thinking, memory, can they follow directions? That's huge for safety. Mobility is another big one. Not just can they walk, but how steady are they? What's their balance like? Risk of falling.
Mm-hmm.
And of course, really understanding how much help they need with those daily personal tasks, bathing, dressing, toileting, that tells you so much about their level of independence and what support they'll need day to day.
And all of this, taken together, helps figure out if that specific adult family home, with its staff and setup, is actually the right environment for this particular person.
That's a really crucial point that the sources bring up again and again. The assessment confirms if the home can genuinely meet the needs identified. It makes for a much better, safer situation for everyone.
Now, I'm curious about how these are done. We hear so much about telehealth and virtual appointments these days. How does doing one of these assessments, say over video, compare to being there in person?
Well, the gold standard really is the in-person assessment. It just gives you the fullest picture. The RN is physically present. They can observe how the person moves, see their living space directly, notice subtle things, maybe how they interact, or slight physical signs that you might just miss on a screen.
That direct observation piece sounds invaluable.
It really is. You
Yeah.
can directly check skin, see how they manage getting from the chair to the walker, things like that.
The virtual has a place too.
Oh, definitely. Virtual assessments, usually done via video call, have become really helpful, especially for maybe follow-up checks or if getting together in person is difficult because of distance or someone's health condition. They still follow the same professional guidelines for gathering the health information.
So same rules, same standards for the information, but in person adds that extra layer of direct physical observation.
Yes, that sums it up well.
Okay, let's talk timing. How long does this whole assessment process usually take, from the actual visit to having the complete picture documented?
Right, so the visit itself, when the RN is with the client, typically takes about an hour, maybe an hour and a half, sometimes a bit longer depending on complexity.
Okay, about 60 to 90 minutes for the face-to-face or screen-to-screen part, and then what happens?
Then comes the behind-the-scenes work. After the visit, the RN needs time, usually another hour or two, to really synthesize everything. They pull together all their notes, the observations, the information they gathered from the client or family, and then they actually write up the detailed report and create that comprehensive care plan we talked about earlier.
And that final report, the care plan, who gets that?
It goes to the care provider, the person running the adult family home. It's essential for them, and often it's shared with the family too, if they're involved, and the client consents. It really serves as that key document, the official record outlining the client's needs and the plan to meet them.
Okay, so you have this baseline assessment and care plan. But people's health isn't static, right? It changes. When does someone need another assessment, a reassessment?
That's a really important point. The sources are very clear. A reassessment is needed whenever there's a significant change in the client's condition.
Significant change. What does that look like? What should caregivers or providers be watching for as triggers?
Good question. Key triggers would be things like coming back to the home after being in the hospital. That's a big one. Or getting a new medical diagnosis. Or if an existing health problem gets noticeably worse, or even significantly better, as that might change needs too.
Okay. Hospital stays, new diagnoses, worsening or improving conditions, anything else?
Yes. Also, significant changes in their behavior or changes in their ability to manage those daily tasks we discussed, like if they suddenly need much more help with dressing or bathing than before.
And why is it so crucial to catch those changes and do a new assessment?
Because the care plan has to match the person's current reality. Needs change. An old care plan based on outdated information might not be safe or effective anymore. Reassessments keep that plan accurate, relevant, and genuinely helpful as the client's life and health evolve. It's about keeping the care precise.
So maybe an actionable takeaway for listeners who are caregivers or providers is really knowing what those triggers are and raising a flag when they see them.
Absolutely. Being vigilant for those changes and understanding that they likely signal the need for a reassessment is key to providing ongoing quality care.
So let's try and, connect all these pieces. Why does this detailed assessment process matter so much to you, our listener, whether you're looking for care for a loved one, providing care, or managing a home?
It really boils down to this. It's foundational. These assessments, they aren't just like administrative hurdles or paperwork. They are the absolute bedrock for providing care that's safe, that's appropriate, and that truly respects the individual in an adult family home. They help spot potential problems or needs before they turn into major issues or crises.
So it's about truly understanding the person you're caring for right from the get-go, not making assumptions.
Exactly that. It takes the guesswork out of it. It ensures everyone involved, the client, the family, the caregivers on the same page about how best to support that individual. And that leads to better care, better safety, and honestly, just a better overall experience for the resident. So wrapping it up, these thorough client assessments done by skilled and experienced RNs are just vital. They give you that deep understanding you need.
An understanding needed for safe, effective, and personalized care.
Yes. As nurses, our aim is always to bring precision to care. And that precision really has to start with understanding the person, not just seeing a diagnosis or a condition.
I like that, understanding the person, not just the condition. That really resonates. And maybe a final thought for everyone listening. Just think about that for a moment. How does taking that time up front to really deeply understand someone's unique situation, their needs, their preferences, before care truly begins, how does that change everything about their daily life, their safety, their well-being in that home?
It shifts the whole dynamic. It
Gotcha.
makes the care truly centered around them as an individual.
So, for any care providers or caregivers out there who are looking for assessments that are accurate, compassionate, and truly comprehensive assessments that capture that whole person,
Reach out to us at Precision Assess.
scheduling one of these detailed assessments is really a crucial first step in making sure the care you provide fits just right for every unique person you serve.